In the San Joaquin Valley region, ICU capacity now at 4.5%. It's a little higher than yesterday. But with COVID cases and hospitalizations still on the rise, hospitals are facing space and staffing shortages. CBS 47's Jocelyn Moran has the story.
Our hospitals are continuing to report shortages of both the space as well as the staff to care for patients.
COVID cases and hospitalizations are showing no sign of slowing down. The Office of the Governor on Twitter today tweeting that there is less than 10% ICU capacity remaining in the state and urging residents to stay home and wear a mask to save lives. But behind these hospitalization and ICU numbers are patients, families, and healthcare workers.
It's not a number for sure. When I walk the units and I talk to my team and you see the patients, that it's truly a very difficult illness as you watch those patients. It's just heartbreaking to see them.
While ICU beds could be full or close to being full, Danette Sisson, the chief nursing officer at St. Agnes Medical Center, says they can still care for ICU patients in other settings of a hospital.
Our emergency department team does have the skill set to be able to care for ICU patients. And so we care for them in that setting while we're waiting for an ICU bed.
Sisson says the message from healthcare workers to the community is help them slow the spread of COVID-19 so that they can have adequate resources to care for you or your loved ones should they need it.
I'd much rather you be wearing a mask than having to wear oxygen or have require a intubation in the ICU, having to be on a ventilator.
And Dr. Voris says as far as the vaccine, they're still waiting on an arrival date, and it really depends on if the FDA approves that Pfizer vaccine in the coming days. Live in Fresno, Jocelyn Moran, CBS 47 Eyewitness News.